Right. Well, thank you everyone for joining us, and thank you to all of my guests here today who are going to talk specifically about, some of the things that they're doing on the ground. I'm here to talk about the American Rescue Plan and really remind us that this is a very significant piece of legislation that has come out of Congress. We know we're still working on the fine points right now, but I want to make sure that we understand that, the purpose of this is to really do three large overarching things. It is to get vaccinations to people. It is to do our best to support students and families so that they can safely go back to school, and to get people back to work and to get this economy going. It's hard to believe that it's already been a full year and we're in this pandemic, but the good news is that we now have vaccines going out at a faster rate and more people are choosing to get them, which is good. We also know that there has been a huge, toll on loss of life, on people getting sick, and then there's the economic toll on all of us. And so I wanted to at least, talk about the fact that this rescue plan is going to focus on key areas, including, getting people their survival checks, really helping families with childcare tax credits, also making sure that we're spending money on getting vaccines out, helping people with unemployment insurance. And for me, what's really important is that I advocated with about 50 of my colleagues in the House to ensure that financial assistance that goes directly to local government, state government, and to tribal nations stayed intact. And for the most part, that was true. And so I have some leaders here on this call with me to really talk about some of the things that we know are going to happen. When we first passed when they first passed the CARES package before I got into Congress, that was a good thing. And then there was another package that passed the House in May, but it got stalled. And so this is really the continuation of recognizing that this pandemic has gone on for an entire year, and the road to recovery is going to take longer than that. The revenues that local government has lost isn't just going to come back because people are vaccinated. The road to recovery is going to be a long one. But I do feel good about the national leadership that we have, and the fact, again, we're focusing on getting shots in arms, children back in school, and really working on focusing on our economy. One of the things that's really important here too is that as we talk about getting more vaccines to people, and we've all had this experience, the logistics have been a challenge. But I do believe that with each iteration, it gets better and more efficient. And again, communities that may have been reluctant about getting the vaccine are now choosing to say, where can I get mine? I think that's really important. One of the things that's important in this package too is that we're replenishing the unemployment benefits that were scheduled to run out on the 14th of March. So for a lot of people, this is a social and economic safety net that's going to help them. There's money to get schools to open safely and make up for lost learning time. We have an entire class of students who pretty much missed a year of in-person learning. And I say this as someone who is a public school student myself, who went through K through 12. And we know that the instruction on Zoom and doing things online is important, but the social, emotional impact and loss of not learning in person is going to have an impact on our students. So we want to make sure that we are mindful of that. And of course, we want our educators to be safe when they come back into the classrooms to teach our kids. One of the things that's important in all of this is that this is money that is very well spent, and it is a good investment in the future. It's going to help us really do a lot of things: become healthy again, address this public health crisis, but also provide economic stability for families, for communities, and for government. So at this time, I'd like to talk to some of my speakers who've joined this. And I first want to start with Mayor Cheryl Selby, and she is the mayor of Olympia. She was she's someone who I've gotten to know over time. And, Mayor, this bill is going to provide about an estimated $10 million to the city of Olympia. Can you speak directly to what the city has been able to do with that aid and why it's going to be important to receive this kind of aid from the federal government?
Did you just see my face light up when you said $10 million? It's like, oh. I also just want to start off with Congresswoman acknowledging that it's International Day of the Woman. And so it's an honor to be able to share the screen with you.
Thank you.
So as you know, American cities and our essential workers have been serving at the front lines of the pandemic for a year now. I mean, I remember this week a year ago, and the date and everything, in the moment you're just looking out and all the world just kind of goes off kilter. You're like, oh gosh, we're in this. So when COVID-19 landed a year ago, local governments were charged with executing an historic public health effort and an emergency response that was unprecedented in our lifetimes. All this while trying to maintain essential services and increase our internal capacity to provide support for residences and businesses that have been crippled by this tanking economy. Small businesses are the economic engines of the country, and local governments understand that. I appreciate that this bill puts trust where it needs to be, and that's into local leaders. Every community is different in terms of needs, but with the passage of this plan, local leaders will now have the flexibility to put the dollars to work quickly. This direct aid to local governments can be put to immediate use now because of lessons we learned from leveraging the limited dollars we received with the CARES Act. So I'm especially proud to highlight the work of a regional model that we developed early on in the pandemic. Local leaders from the economic development and social services sectors pulled together in April of 2020 in Olympia to develop a collective impact model based on response, recovery, and resilience. With seed money from the cities in Thurston County, Thurston Strong was built. Like the lean machines that local governments are, Thurston Strong provided immediate counseling to small businesses to help them access PPP loans and PPE for their services. And they also helped with processing unemployment claims, helping businesses redesign office space and service spaces and restaurant floors. We also provided emergency aid to community members struggling to pay for essential needs like rent and utilities, all while creating a pipeline to provide assistance to the community so they could access other federal dollars as they became available. Thurston Strong is like a well-oiled engine, but right now we're out of gas. I know that we'll be able to put these additional dollars to immediate use and help the most vulnerable and lowest resourced households in our communities while building a more resilient and equitable economy for all. So other challenges that this money will help us with, Congresswoman, are we have the eviction moratoriums ending soon. So being able to extend renter protections and landlord support are crucial to prevent the rise of homelessness. Immediate utility relief. People shouldn't be choosing between paying their rent and catching up on utility bills. We want to be able to help wipe out utility debt for all of our community members. There's ongoing hygiene and food assistance that's needed to go out into the encampments of folks that are experiencing homelessness. Again, aid to small businesses and especially our shuttered arts and cultures venues that have been just devastated by this, and rebuilding what makes a community is part of that placemaking, and that is our arts and cultures and heritage centers that we want to be able to be there when we can go back and be together. So focusing on main streets and downtowns, we were devastated by the double whammy of the closures and closing up storefronts, but also with the summer of protests that we need to come back from. And then retraining support for dislocated workers, and again, backing up our child care systems as people can go back to work, as kids get back into schools. So I got literally emotional earlier on getting prepped for this, just listening to all these things that we can now do. And with the vaccinations being available, that, the strain that our communities have been through is so immense, and we're not even going to realize it now. It's going to, as we start to come back together and share our stories. So thank you so much for all of your support, Congresswoman Strickland. I appreciate your role as a mayor. You understand how important, but also how stressful it is to be in local government at this time. So thank you.
Thank you, Mayor Selby. And for those of you who are not aware of the makeup of the 10th Congressional District of Washington State, it is urban, it is rural, it is suburban. We have a lot of employees who are employed by the public sector, a lot of government organizations, state government, local government. And then also too, we have the honor of hosting the largest military installation on the West Coast, Joint Base Lewis McChord. So I'm now going to turn this over to Mayor Don Anderson of Lakewood. And Don and I have worked together for years on a lot of different projects, including transportation. And he's also serves as co-chair of the South Sound Military Communities Partnership. He's had a long record of service. And I'd like for him to share his thoughts on, why getting these funds into local government are so important. Mayor Anderson.
Well, thank you, Congresswoman. And I think it's really important to note that the Congresswoman's history as a mayor, and we got to work together as fellow mayors, gave us a real sense of confidence that local government would be looked out for in DC. One size doesn't fit all, and that mayoral experience really helps. Our frontline workers didn't miss a beat. Most of the workers in Lakewood are either in public safety or public works, and those things can't be done remotely. What we did do remotely was building, permitting, and inspections. People went out in the field, and that actually had an uptick during the pandemic, much to our surprise. So those frontline workers were out there every day doing the business of the city and keeping it running. They didn't miss a beat, but we did have lost revenue. This package provides for revenue replacement to municipalities who sorely need it to make up for the actual extra expense they had during this pandemic. And then every city is different. Some are entitlement cities under CDBG, some aren't. We are, as is Tacoma. Some are in counties that have 500,000 people or more and got that county help during the first round. We are. Thurston isn't. So we as mayors and city councils know what the differences are and where the holes are. For example, in Lakewood, the normal break between a home ownership and renters is 60-40 ownership. We're exactly the opposite. 60% of our people are renters. And there is much need both for the renters and for their landlords to get relief. And this bill provides that, as did earlier efforts. And that's more important in our community than it is in most. Also, we rely more on small business than most people do, or most cities do. We have literally hundreds of mom and pops, a plethora of mom and pop ethnic restaurants, for example, who are very thinly capitalized and really need the help. So our focus has been on renters, landlords, and small business. And in addition to that, we have the opportunity to plug holes in the social services that are generally provided through the state or passed through the county and not by our city, but we know where the gaps are. So what this gives us an opportunity to do is replenish our coffers, keep going forward, providing everyday services as we always do, and then knowing our community, aiming at those who need it the most, the renters, the small businesses, and the gaps in social services to provide the relief that we need both for resiliency and recovery. So thank you, Congresswoman, for looking out for our community. I'd like to say on that last faux pas, I am the proud father of 4 professional women. So being surrounded by women on this International Women's Day is just a normal occurrence for me. But thanks again for all you do, and we're proud to support your efforts in DC.
Great. Well, thank you so much, Mayor Anderson. And for those of you who don't know the 10th District, Lakewood represents the largest city in my district. And he's right about the businesses owned by people of color. I mean, that really is where the International District, or I affectionately call it Koreatown, is. And some of the largest and most populated Korean-owned businesses are right in the city of Lakewood. So thank you for your support, Mayor Anderson. Now I want to turn to our public health official here, and this is Dr. Anthony Chen, and he serves as a director at the Tacoma-Pierce County Health Department. And he is the top chief strategist when it comes to public health. They have been in the thick of this. I've known Dr. Chen for a long time, even when I served on the Board of Health. And I just want to say, thank you, Dr. Chen, for keeping a level head in all this, dealing with facts and science, and really doing your part to help ensure that we are addressing this pandemic how we should. So Dr. Chen, I know that you are doing important life-saving work. There are a lot of logistics involved in this, but also, your ability to use science to talk about this. So as head of a health department, tell us how receiving federal funding helps you do your work better to serve the public.
Thank you, Congresswoman Strickland. We would not be able to do our work without the federal funding. When you think about what we do as a health department, we plan for situations like this, although COVID-19 has totally blown our socks off, right?
Okay.
But we plan so that we can respond when it occurs. And we can only do this with the support of partners. So we control and prevent, right? So we test, we find cases, we track the data, We help people who are positive or who need to be in quarantine, help them make sure they have a safe place to isolate in quarantine. We even make sure they have food, that they get their medicines, whatever they need. And then now increasingly, we're supporting the vaccination effort, coordinating that and directly ensuring that. The American Rescue Plan provides critical aid in the fight against the COVID-19 pandemic. More than $7.6 billion will go towards hiring contact tracers, case investigators, public health nurses, epidemiologists, community health workers, and other essential workers to help assist in the efforts to address COVID-19. Why this is so important is to give you an idea. We have 300 employees. We still have about 120 of them pulled away from their normal jobs, activated to help with the response. And because of CARES funding in the past, we have been able to hire another 200 or 300 temporary workers. This is how big the work is. If you think about the 120 or odd people who are pulled away from their work, I mean, we have nurses who normally are supporting pregnant mothers in their pregnancy and in the beginning of their children's lives, and they're being pulled away to help with case investigation, contact tracing, outbreak, and supporting nursing homes, things like that. So we're fortunate that we have the funding so that we're able to do that. The legislation would also provide significant funding to bolster the nation's vaccine distribution and administration efforts, including $7.5 billion to the Centers for Disease Control and Prevention to plan, prepare for, promote, distribute, administer, monitor, and track COVID-19 vaccines, including providing support for state, local, tribal, and territorial public health departments. Anyone who's either been a first responder, in other words, the people in phase 1A, people who are over 65, in other words, people who are in phase 1B, and then now, the teachers, the childcare workers know that's been very difficult for people to get vaccine because the supply isn't there. And, we're hearing from people that it's very frustrating for them having to, go online or call phone numbers. And we also know that we're not equitably reaching the people in greatest need. So we also have been working with our partners to make sure that we're reaching, the elderly, people who don't have computers, people who are not, who maybe don't even have internet, people who may not speak English, people from certain communities where there's greater concern about taking the vaccine. And so we're, on the one hand, needing to support the backbone infrastructure, which are our hospitals and clinics, to deliver the vaccine. We're also setting up mass vaccination sites so people can come and get vaccines if they don't have a medical home to do that at. We're also doing, smaller clinics, mobile teams, and so on. So all of this, of course, requires funding and support. These are not normally things we do. Even Mayor, I still call you Mayor because you were our mayor, but Congresswoman Strickland, I think you remember during H1N1, we did not do a single mass vaccination site. That was in Pierce County. We did it all through clinics and pharmacies. Now the magnitude of the problem is so large that we've got to use every single possible strategy. And of course, the bill would provide more than $50 billion for testing, case investigation, contact tracing, mitigation efforts, public health data surveillance and analytics infrastructure, modernization, genomic sequencing, because the state's got to help coordinate that. We can help find the cases, but the state helps us determine if these cases have any of these new variants, what are the new patterns going on? We've got to coordinate that as well. So all of this money is essential funding. And thank you so much to you and other members of Congress who saw the need to move quickly on this and to get the funding passed.
All right. Well, thank you so much, Dr. Chen. And again, thank you to you and your staff for all the work that you do. Now, I wanted to have a chance to talk to an actual frontline worker. And I have with us here the Health Center Administrator, Jesus Valdez, and he's with CMAR Community Health. And he's been working in community health for about 5 years now, and clearly has been on the front lines here as we're talking about dealing with this pandemic. So Jesus, as a frontline worker at a health center receiving federal funding, what does it mean to you to know that federal help is on the way, more help is on the way, including not just aid, but what's going to help us boost vaccination? And tell us how your coworkers are feeling right now that we know more help is on the way. And thanks for being here.
Thank you, Congresswoman Strickland, and thank you for having me. I can just like Mayor Selby mentioned, I remember this week last year. I remember exactly, the sense of anxiety coming into the building on that morning, the Monday, and going through our rooms and counting our PPE one by one, our hand sanitizers, our gowns, gloves, masks, and knowing that we probably were not prepared for this pandemic to the scale that we were going to need to be. And so having that federal funding and that money coming in, it really meant that we could rethink our model of delivering services, from going virtual, such as avenues like we're conducting today's press conference, and providing care to patients in that way, to implementing an outdoor testing model where we could test patients for COVID-19 outside, but of course that requires federal funds, and being able to invest those into buying tents, testing supplies, PPE, just like I spoke about, and being able to provide that to our staff who were feeling that anxiety of potentially bringing the virus home to their families or loved ones because they were on the front lines. And so being able to protect them in that way and knowing that we were going to be able to provide those critical infrastructure needs for them was incredibly comforting at that time. And now that we're full scale vaccination efforts, and scaling that up, it's incredibly important for us to be able to have, again, the same thing, the PPE supplies, to have the vaccine supply in order to be able to deliver these vaccines. I've been at the front lines, talking to a lot of the recipients that are getting our vaccines, whether it be registering them, or moving them through the queue, getting them into the room so one of our vaccinators can come and vaccinate them. And a lot of them are feeling a sense of hope for the first time. And what I can remember has been here, and being able to see their grandchildren, some of them being able to meet their grandchildren, and being able to go back to school with their kids, now that school teachers have become eligible in Washington State. And feeling that sense of knowing that pretty soon they're going to be able to be back in the classroom. And so to be able to help with that, I think a lot of our colleagues here and all of our staff are feeling the pressure. They're feeling it's good old fashioned hard work. It's no getting around it. But we know that this is where we're needed. This is what we have to do. And to be able to provide more help to those folks who have been working tirelessly, to be able to hire more people on board, to do a lot of that outreach that Dr. Chen talked about, to get those folks who otherwise wouldn't have access to vaccines, to get them into our clinics, to get them vaccinated, to be able to provide those services for our communities all throughout Western and Washington and throughout the nation. It's critical for community health centers such as the one I work at. It's really exciting to learn that we have more help coming on the way.
Right. Well, thank you very much for that, Jesus. And, as Mayor Selby said, she just gave examples of how she and her city could use that funding. And it's everything from helping economic development to getting renters relief to, just the myriad of things that happen in local government. Mayor Anderson talked about, there are some jobs you have to do in person, public works, handling the basic essential functions of government, but also having a chance to backfill lost revenue because revenues have gone down and been flat, but the cost of administering government has actually increased. And so here's a chance to do the work. And of course, to our public health professionals, both Dr. Chen and to Jesus Valdez, just making sure that we're getting people vaccinated, that we're standing up public health infrastructure that is going to be sustainable so that when this happens again or we have another major event, we're prepared for it. And so I thank all of you for joining us. The American Rescue Plan is one of the most consequential pieces of legislation and efforts that have come out of Congress. Again, this is about dealing with a pandemic. It's about getting shots in arms, getting students back in school, and getting our economy back on track. In Washington State, for example, we know that so much of our economy depends on tourism, and that affects every single city in the South Puget Sound. until people feel comfortable traveling again, it's going to have an impact on our economy. And tourism is related to not just air travel, but it's hotel stays, it's people going to restaurants, it's checking out different parts of this amazing place we call home, and just having the ability to have a full recovery. So thank you to all of my guests for joining today. I think in closing, I just want to give you an idea of some of the local funding that could come our way. And these are just estimates. For Pierce County, about $176 million. For Thurston County, $56 million. For Mason County, $13 million. For the city of Tacoma, $63 million. For the city of Olympia, $10 million. And for the city of Lakewood, $15 million. So those are just a few examples of cities and governments of different sizes who can benefit from having that local funding coming directly so that they themselves can determine how that money is spent, because every community is unique. So I'm going to stop right there, and I know we're going to open up the floor to questions, and I hope that my colleagues who are here on the call as well will be able to answer questions too. So thanks everyone for joining us, and Katrina, I'll turn this over to you.
Thank you, Congresswoman, and thank you to all of our speakers and everyone who was able to join today. We can now take this opportunity to open up for Q&A. And as a reminder, if you'd like to submit a question, you can do so now using the chat feature. So please make sure that you include your full name and publication, and just notify us in the chat. Again, we can open for Q&A if you have a question for the Congresswoman or any of our speakers today. Okay, so we are getting a question from Ryan Harris with Como Radio.
Okay. Hey, Ryan.
Hi, Congresswoman. Thanks for taking a few minutes to talk to us. As this bill was going through the Senate, I don't want to pin the comment to Senator McConnell, but I believe it was him. But at least one of them called it another case of just wild Democratic spending. And I'm just wondering how you respond to that.
Well, my response has a couple of different dimensions to it. This is not a partisan issue. COVID is not a partisan issue. And there is a very good reason that national bipartisan organizations support this American Rescue Plan. The U.S. Conference of Mayors, the National League of Cities, the National Association of Counties, and even here on this call, we have bipartisan support. And so he can call whatever he wants to, but the vast majority of the American people support this because COVID, the tragic deaths, and the economic impact has affected all of us.
Thank you, Congresswoman, and thank you, Ryan. If we have any additional questions, please drop them into the chat, and that way we can make sure that we get questions from all of the press on the call who would like to ask. Mayor Selby, did you have a question?
I hate dead air. I figured I had to ask a question. So will there be a time limit, Congresswoman Strickland, on how soon the dollars have to be expended? We ran into some, I'm sure Mayor Anderson can agree that, like, oh my gosh, all of a sudden they said, oh, you have to spend this in 60 days. And it's like, to make the highest, best use and the smartest choices, you don't want to make it knee jerk. And so I just didn't know what the time limit would be on the fund.
So Mayor Selby, from what I understand, it is going to be until this pandemic is over. And as you know, revenues don't come in one lump sum, and the ability to use it and spend it responsibly is not going to happen overnight. And so from what I understand, it's going to be until the pandemic is over, whatever that means.
Okay.
I think Mayor Anderson has a comment on that too.
I actually read the Senate version last night,
Okay.
and it provides that the first tranche of funding to localities is within 60 days of enactment. The second tranche is not for a year, and there's till the end of 2024 to spend the second tranche. So it's going to be more of a marathon than a sprint this time, I think.
Good. And that's a nice long runway. So thank you for that, Mayor.
All right, I'm not seeing any additional questions in the chat, so we can go ahead and close out today. I don't know, Congresswoman, if you had any additional remarks for the group. Thank you to everyone who joined, and that is the last question we have, and we'll just go to the Congresswoman if she has anything else to say before we end the press conference.
No, thank you. Again, thank you to all of my guests for joining today, and thank you to the members of the press for joining. I just wanted a chance to really talk about the American Rescue Plan and really drill down on how this is going to help local government. And again, you know, I fought really hard to make sure that that stayed in the plan, and it did, but also reminding folks that, you know, this is going to help people who are unemployed. It's going to benefit small business. We're going to really ramp up the COVID relief with vaccines and testing and tracing, and really doing what we can to, you know, defeat this pandemic and also get our economy back on track. This is a very good, smart investment for the American people, and I'm proud to have had a part in voting for it. So thank you everyone for joining us today. And thank you again to my fellow former mayors and my guests.